Dr. Hyde is an internationally renowned clinician and researcher and has been working with CFS FM patients for almost 30 years. What makes him so fascinating, other than his vast wealth of knowledge, is the fact that he has a background in forensic medicine. And I'm sure many of you have been to doctors, and as complicated as we are as patients, we don't fit in a box. We don't fit in any box. And in this country, they want us to fit in a box. And most doctors don't have the time, and they don't have the knowledge. And in Dr. Hyde, what's kept him going all these years is the question, why? What's going on with us? And that's where the forensic background comes in. He also told me he was a geophysicist. I didn't think am I right? Okay. I didn't think I'd remember that big word at this point, but I went for it. And he's absolutely fascinating in his knowledge, not just of the patient community, but the world. He travels constantly, he does consultations, and I was teasing him and said, you know, if he comes down here, we could keep him busy for a week or two, but he can't practice in the States. So my next goal was to get a busload of people to go up to Ottawa, and we can't do that either. So the best thing we can do is have Dr. Hyde as our speaker. He is the founder of the Nightingale Research Foundation, and he took the name in honor of Florence Nightingale. Some of you may know this already, and some of you may not, but Florence Nightingale was thought to have ME. And she started the nurses from her bed. It is amazing what she did. And if you look at what our organization does with all volunteers as sick as we are, and we don't look sick, it is mind-blowing. We live one day at a time to help others, and we look back at what we've done, and it's amazing. So without my further vamping, and you've got a little background on Dr. Hyde, it is my honor to present to you Dr. Byron Hyde from Ottawa, Canada.
I had an advantage that most physicians don't have. When I was in grade 8, I had polio, and so, which was really wonderful. First of all, when you have polio, you have no pain. The second good thing about it is you don't have to go to school. And so I spent what all of you did in grade 8 in bed. And the other wonderful thing about polio, and when I was in grade 8, was there was no homeschooling. And so I had no homeschooling, and the only person who came to the house was the city librarian. And I started reading, and I unintentionally read through the first and second year university courses in literature. And unfortunately, I began to walk again at the end of grade 8, so I had to go back to school in grade 9, which was quite a tragedy for me. So I know what it's like to be disabled. I know what goes on. And the other problem I had since the age of 12 is I had migraines. And in the last year of university, at the University of Toronto, I threw a migraine in the very last exam. Now, that was history, and I had the highest mark at the University of Toronto in history, but because I didn't show up for the exam, because, well, I showed up, but I was in no state to write it, the doctor said, "I don't believe you." And I said, "That bugger." And I had to rewrite all of the final years of my BA level at the University of Toronto all over again from the beginning. And I said at that time, when I get to be a physician, I'm always going to believe my patients. And I think this is really useful background information in understanding patients. Now, we're going to go through several different talks here, and I don't intend to badmouth physicians. Physicians have a hard job, and they do really good work, and they make excellent diagnoses in about 90% of the patients. And they lead to treatments, cures, understanding of what's going on in those patients. But there are 10% of the patients of which you people here form a small group that they're too much for our understanding of physicians. And I'm going to get into this. Now, the other thing I want to tell you as background is this wonderful man, Charles Poser. There was an epidemic of ME, CFS, whatever you want to call it, in Canada in August 1984. And I went down to the Center for Disease Control in Marietta, Georgia, and asked them about this, and they knew nothing about it. But they said this man at Harvard, the late Charles Poser, knew a lot about it. And the interesting thing is he was one of the world leading expert in multiple sclerosis, in MS. And what he did was he got a lot of referrals of people like you to his office. And when they came, the doctor said, this is MS. And this was before MRIs, magnetic resonance images, and CT scans of any great importance. And so he did the traditional workup on these patients. And he found that once he did the early MRIs on these people, they had no lesions in the brain. But what they did share with MS patients was they had positive oligoclonal banding in the spinal fluid. So all of the people here who have an MECFS type acute onset, as opposed to gradual, acute onset disease, in the first year or two of their illness, if someone did a spinal tap on you and a blood as well, because you have to do both at the same time, and look for oligoclonal banding, if it's positive, you either have MS or you have ME, chronic fatigue syndrome, acute onset chronic fatigue syndrome. What is important about that is oligoclonal banding occurs when you have neuron breakdown, nerve cells in the brain breaking down because they're being injured in a chronic basis. And it doesn't happen in one day. It goes on for weeks and weeks and weeks, as anybody here knows. So I went and I sat, and in fact, he said, look, don't stay in a hotel in Boston. Come and stay with me. And he lived in a brownstone house, and he fed me and talked to me and took me to the university, and we spent 2 or 3 days. And I said, that's really nice. Now I'm going home. He said, oh, no, you're not. He sent me off. Well, I'll show you later where he sent me. But he sent me off to England to see who he thought were really the experts. So I went off to England for a month, and I got back to Canada after that. And damn it if he didn't send me 3 or 4 patients from the United States to examine, because he said, now you know more than I do, which I don't think was true. So that was Charles Poser. And right from the beginning, acute onset, as opposed to gradual onset, ME or CFS, is caused by an injury of the brain. And if you look at these brains, and we're going to show you these, what you're actually looking at is a diffuse encephalopathy. Now, if you have a pocket encephalopathy or a bullet in your head, a neurologist is going to be able to pick that up with a hammer. He doesn't need any more. A hammer and needle, he can probably pick that up. Few tests, and that's it. But really, what we're actually looking at with a diffuse encephalopathy, all the neurological tests are normal, or most of them are normal. And so the neurologist says, well, I don't want to see you. There's nothing wrong with you. It's not the fault of the neurologist. It's the fault that a diffuse encephalopathy does not respond to a normal neurological testing. It does show up on several different tests. SPECT scans, it can show up. PET scan with the proper software, it can show up. It can show up with another invention that occurred here in Boston, which you call a beam scan, and this is electronic computer-driven EEG. That will show it as well. And from a forensic medicine point of view, we also did carotid and transcranial Dopplers. Now, this is a very simple test, but you look at the blood flow going through the carotids and into the main arteries of the brain. And this is a test that was developed at Harborview Hospital in Seattle. So all of these technologies are available in the United States. But as a person with a forensic background, you go to court, nobody believes you if you say, well, these people got a positive SPECT. But if you show that they've got a blood diffusion problem in one area where the SPECT shows there's a problem, the beam scan shows the same problem in the same area, all of these, they can't argue with you. You've got, in effect, an engineering principle called triangulation. You've got 3 or 4 different things coming together to show one thing.
You're 19. 19.
Yeah.
Yeah. And what happened to you?
Stroke.
You had a stroke last year.
Yes.
And what happened? Can you remember what
I want you to listen if you can, watch this girl, and see if there aren't elements of her in you.
School.
Because she has a thing called dyslexia, dysphasia,
Okay.
she has
And
difficulty
I,
talking. And when people
book,
first fall ill
and I read it
with an
aloud,
acute onset ME or CFS,
but I can't
they're just
because
like her.
stroke. And so I send her, and also it's the same as the same of kind of thing as you know.
Pins and needles?
Yeah,
like pins
the
and
same, and also arm as for
leg.
yeah, yeah.
And what happened after the stroke with your speech?
Well, I can't.
You have speech problems.
Yeah.
Do you know what that's called?
Yeah. Aphasia.
Yeah, good, good. I haven't heard you say the word before.
I write it down.
And that helps.
Yeah.
Okay.
I'm going to leave that. But why I wanted to show you this is what we're dealing with here is a diffuse brain injury caused in this girl by a hole in her heart between the left and right ventricles. And a small blood clot goes through and breaks up like a shotgun pellet and hits a diffuse area of the brain. And in her case, she developed this dyslexia, this difficulty speaking. She can walk, she can pick up things, she has a bit of difficulty with muscular control all over the body, particularly in the arms. And I want you to think, what real difference is there between that and ME and CFS, except in degree? And even in degree, a lot of people with ME and CFS are just like this now. So that's the first thing I wanted to show you. Why this, I've done 2 things now. I've shown you the fact that, number 1, these people have oligoclonal banding, meaning neuron breakdown. Number 2, you're not any different from this person who's had a stroke. So this is really, really important. Now, I want to talk about why doctors can't diagnose. And this is not a criticism of doctors. As I started off saying, doctors are brilliantly trained, and they have this technique of what I call a guess diagnosis. And they essentially look at a person coming into their office and make the diagnosis, and 90% of the time they're right. 10% are not, and you people fall into the 10%. And I think one of the things here is the last thing, there's no fee for an in-depth investigation. And so it's like asking you to volunteer, and you don't mind volunteer for the association for a couple hours a week or even longer. But if they say, well, I want you to work 48 hours a week full-time for the rest of your life, but I'm not going to pay you, you tell them to go to hell. And essentially, that's what the doctors are doing. If they don't get paid to do an in-depth, complete investigation, they're not going to do it. 1 or 2 might do it, but in general, they're not going to. And the other thing is this educated guess diagnosis. And the doctor comes in, sees you, you know, he assesses your station in life, your address, your income, your gender. Do this all by your clothing, the way you walk, the way you talk, everything. And are your complaints vague or are they precise? Well, most ME and CFS patients, they're vague. And they get the obvious diagnosis, psychiatric diagnosis, because they are vague. But so are the doctors, because they don't really know what's going on with these. I've said this already. And there's all sorts of pseudo-diagnoses, and don't get me wrong in the fact that these aren't real, but CFS, CFIDS, fibromyalgia, irritable bowel syndrome, non-major depression, anxiety neurosis, hysteria, conversion, or somatization disorder. There's no test for these. These are not diseases. These are syndromes of illness. It's like saying you've got a headache. Your headache could be due to migraine. It could be just an injury to your neck. It could be due to a brain cancer. It could be due to someone's got a hatchet in your head. Headache doesn't tell you what the cause is. Pain in the toe. It could be gout. It could be you stubbed your toe. It could be cancer. It could be a fracture. Pain in the toe is like all of these things it doesn't tell you. You have to go behind the mirror, if you will. Anything that says syndrome or disorder after it is not a disease. It's an indication that there's something significantly wrong in most cases, and it has to be looked for. And then there's the forbidden diagnoses. There's all sorts of illnesses, and we're going to get into this if we have time, created by doctors, but mainly by the pharmaceutical companies who give doctors bad information about medications. And there's also problems with immunizations. Now, if it weren't for, don't get me wrong about informations, if it wasn't for immunizations, at least half of you would not be sitting here. Perhaps a quarter of you would be dead. Another quarter of you would be so hideously deformed or deaf or blind or such heart failure that you wouldn't be here either. Immunizations are better than all the doctors in the world put together, but that doesn't mean there aren't problems with some immunizations. And there's two in particular which I get into trouble whenever I'm speaking to doctors. One is recombinant hepatitis B immunization. We've got over 200 patients who are housebound and have been so, some bedbound for the last 10, 15 years. That immunization came out in 84, 85. We immediately got a few deaths, and it went on. These people tend to develop dysautonomia, a disconnect between the brain and the ability to maintain a normal pressure in the peripheral arteries. Now, this is one of the reasons doctors can't examine you properly. There's a fee schedule. This is Canada, but the United States is similar. In the UK, it's a fee. They don't have fee for service. They pay you by the number of patients you've got. And to get a reasonable group, it ends up you have to have a couple thousand patients, so you don't see them more than 5 minutes anyway. And here's the problem. Minor, they get $20 in Canada, and that's for 10 to 15 minutes. And intermediate, that means that your nurses check their blood pressure or their weight, and then you ask them what's wrong and maybe look at the throat. That's intermediate. And this is a major is a complete assessment, which used to take an hour. Now most doctors seem to do it in about 15 minutes, unless you're lucky and you've got a good doctor who takes me 2 hours to do a general assessment. So you can see it's not going to pay. My secretarial staff in 2 hours, and my researcher would get $80. So I'd be working for free. So it doesn't work. Consultation with a referral physician, psychotherapy, depending on who you are, 110 to 150. Mayo Clinic, to assess people with ME and CFS, and they do a horribly bad job. They do a good job in a lot of things, but in ME, CFS type patients, they charge roughly $20,000. They spend 1 to 3 days, during which time they've seen you for 2 to 4 hours. 2 to 4 hours at that rate is $500, but they charge $20. Now, they do tests as well. In Canada, we're lucky in that we can do them for free. Now, the other problem with doctors is that there's no fee for the time it takes a doctor to order or obtaining tests. And if you're going to do an MRI, I take a 2-page write-up of what we found in the patient. That takes me about half an hour. And I can get my patients in within usually days and weeks, 1 or 2 weeks maximum for any of these tests. The regular doctors in Canada, it may take them up to a year. But I write out everything, so the neuroradiologist is fascinated, and they want to see this patient and find out what's going on. But it's also very helpful, because you ask them what to look for. There's no, so you get even an ordinary x-ray back, and the report says normal, and you say, well, it doesn't look normal. And you look it over, there's no fee for you doing that. So you phone up the radiologist and say, can I come over and look at this x-ray with you? And he says, sure. They always say sure. Nobody pays any attention to them, so they're really happy to see people. And so you go over, and you say, oh my God, yeah, there is this thing here. And that takes me an hour and a half to get to the hospital and back, maybe 2.5 hours. There's no fee for that. There's no fee for your doctor to do that. And I'm not giving your doctors a whitewash, but this is true. Unless you pay people in our economy, in the North American, Western European economy, they're not going to do the work. And the system doesn't pay for it. And how they would, this is my house. It was built in 1942 for $4,000. I bought it in '68 for $39,000. I still live in the house. It's now worth $1.2 million. The point is that a general assessment in 1970, same time there, you got $15. Now we get $77, okay? So the assessment, so what's happened with the house costs? The house costs went up 30-fold in this period I've been living in it. But the physical exam has only gone up 4 or 5 times. So this is what has happened to physicians. You used to think physicians were wealthy. They were. They're not anymore. And they have to work around the clock. They have to see patients fast just to even break even. They're not wealthy like they were when I started. I paid off my house in 4 years. I worked night and day. I paid off the $39,000. I made $10,000 a year clear. I paid off the house. It was paid. For me to buy this house today, in 60 years, I wouldn't be able to pay it off. And that's what has happened to medicine. This is why you cannot get properly examined unless there are physicians to specifically look at your kind of illness at a university level and in depth. And the other things they've done is they've used this educated guest diagnosis, multiple examination rooms. They run back and forth. Now, that's all I'm going to say about that. But there's another problem. Another Canadian doctor who became chief at Johns Hopkins in the 1890s developed this audacious idea that before you treat a person, you have to find out what's wrong with them. This was revolutionary. The doctors thought this guy was crazy initially. Why? You have to find out. I mean, can't you just take their pulse and they're hot, they're cold, you give them a bit of this or that? And so this was wonderful. But he was wrong in one thing. And that is doctors rarely look for causes, SS, of illnesses in complex illness like you have. I have never examined a single ME CFS patient that has a thing wrong. I've got patients with 20 actual pathologies. 20 bloody things wrong with them. I mean, They could be cancers. They could be major arteries obstructed. There could be coronary artery disease. There could be all sorts of autoimmune diseases. You people are the most fun in the world to examine because you got so many wonderful things wrong with you. And this is really actually exciting from a medical point of view, because you never know what you're getting when you're going to examine these people. So if you say you've got ME or you've got CFIDS or CFS, you don't have a disease. What you have is you've got a group of pathologies that are making you ill. And when we go through our checkup on these people, we don't find all of them because our medical testing ability is not that good. Nobody's in the world is that good. But we can find most of them. And we might find, as I say, 10, 15, 20 things wrong with the patient. And you look at them, and some of them you can't do a thing about. Some of them you can sort of help. Some of them you can actually cure or fix. And the interesting thing is when you do a full summary of these individuals, and you then say, well, I can't do anything with that. I can give this that will help that. But these I can cure. Often the patient just pops up and they're good again. And this has made me realize that most healthy people have got a hell of a lot of things wrong with them, but they haven't had the straw that breaks the camel's back. And that can be a minor infection. It can be a minor or major automobile accident. It could be a transfusion with the wrong kind of antibodies coming in, even though it's the right type of blood, because you can't examine blood for everything. It could be almost an immunization, which on top of a minor infection is enough to throw you off the edge. So there is this straw that breaks the camel's back that is responsible for some of this. Now, ever since I've been looking at patients like this since '88, American doctors have been coming up to me and saying, what treatment do you give them? I say, for what? You don't treat chronic fatigue syndrome. You don't treat ME. You find out what's causing it, what is behind all of this, and try to treat that if you can. The other thing they said is, can you send me some patients? Because a lot of these people that Stephen Strauss funded didn't have any patients. Never saw an ME or CFS patient before in some of them cases. Now, I want to show you this as well. This is September 1990, the CFIDS Chronicle from the Carolinas. David Bell, Elaine DeFreitas, Paul Sheeny. Now, David Bell is a wonderful, wonderful man. He came to Harvard, to one of the hospitals here, and the doctors made fun of him. And he, after, I think, less than a year, went back to New York State. He's retired now. This is the wonderful Paul Sheeny. Paul Sheeny and David had nothing to do with this business of this retrovirus that they discovered thought they discovered in 1990. And so, but they're up there because they're well known, and they gave credibility, and they believed that Elaine had found this virus as a cause. I have a list, I don't think it's on this panel, of over 15 sure viruses that have caused ME and CFS. You can't do it that way unless you go to an epidemic and recover the blood of all the people at that time and get rising titers. You can't do a blood test and find the cause of your illness in terms of viruses, because we're like the Federal National Library. Every virus that has ever come our way is in us. And we can get the antibodies of every one of those antibodies. And of course, 99% of them never made you ill because your immune system knocked them out right away, and you didn't even miss a day of school, you didn't miss a day of work. But those viruses are there, and you've got antibodies that will come out and destroy them if you get that infection again. So I gave you that because the next slide is this one. Vince Lombardi, Dan Peterson. Again, Dan Peterson had nothing to do with this, but he is the shareholder and partner of Vince Lombardi. How many here sent their blood off to get tested for this retrovirus? Could you put up your hands? One? Only one? Wow, you're smarter than I thought. Okay, it came out in Science. The next day I was made aware of it by a patient, and it said that this MRV, mouse virus, retrovirus, was in the majority of chronic fatigue syndrome patients. And then it says Lombardi, co-founder of Red Labs. Well, it said Lombardi was one of the guys. So I go into the database of Whitmore Peterson Institute, and I look up Lombardi. And he says he was a co-founder of Red Laboratories. Now, I know the co-founder, or the founder of Red Laboratories. He's a guy in Texas who's now is a film writer in Hollywood. And he used to do my tests on my patients for free in the 1980s. Lombardi wasn't even a lot, more than out of his diapers at that period. There's no way he co-founded Red Laboratories. Now, there's another Red Laboratories in Dr. Demera in Demala, I can never pronounce his last name, in Belgium, who's being sued by him for millions of dollars for fraud. So I know he didn't co-found that either. The other thing it says, he studied under Dr. Soholnik at Temple University. So I pick up the phone, and I phone Robert, who's a wonderful, wonderful researcher man, and I said, tell me about Lombardi, who studied chronic fatigue syndrome under you and did research with you. He said he never did. I said, oh, what do you mean you never did? Well, he came here for a few days, and I got rid of him because he was a nuisance and he didn't know what he was doing, and that was it. You go on today to Whitmore Peterson Institute, and I got this material 2 days ago off that. So the website still is saying this. So I knew it was fraud. So I went to the Canadian Viral Center in Winnipeg, or at least I believed it was a fraud. Whether it was, I don't know. I don't want to get sued on this. So I checked with them and said, look, they can't do what they're doing. And the other thing with, it says it's not possible. And, but with all of this, I knew that there was something wrong going on. I figure they made somewhere between $2 or $3 million on that. People all over Europe, people all over Canada, United States were sending their blood in. And the other thing which is interesting is Whitmore Peterson advertised as a charitable institute. It's not a charitable institute. It's got a cameo institute on the floor below, which is for fee for service. And they're there to make money. It's American system. You don't work without making money. Now, this is my office. It's not exactly downtown New York. That's the entrance. It's in my house. It's been there for the last 43 years. That's where I see patients. They come from all over the world to this little place. This, if you want to have more information on this lecture, a lot of it is in this booklet, which is, I think, $20. You can get it on lulu.com. I think it's around $20. But it basically is going over a lot of what I'm talking about today and more. It's probably cheaper if your organization gets it for you. Oh. Charles Poster sent me to this man. This is Dr. John Richardson at 80. He's just stepping down from his tiger moth. He had ME. And he got better. And he flew around in this First World War fighter plane. And he worked until he was 82 and fell ill and went to the hospital. He was dead 4 days later. So he worked literally up to the time he died. Wonderful man. I went there after being sent from Harvard to Newcastle. And I figured, you know, he'd spend a few hours with me and tell me what he knew. And he said, well, how long do you want to stay for? And I said, as long as you want. Fine, you're staying for a month. And so I learned so much from this gentleman, and I'm very, very sad that he died, like all of us must someday. This is the bane bear, as far as I'm concerned, of ME and CFS in North America. He put $40 to $60 million into the study of chronic fatigue syndrome over the period that he was in charge. And he will tell you that, no, it wasn't me, a committee. He was the head of the committee, and he told them what to do. And of that 40 million, I got really angry at the Canadian government. They didn't do anything about these patients. So I thought, I'm going to shame the Canadian government. And I phoned the American system at the National Institute of Health, NIH, and I said, can you tell me where that $40 million went? And they said, well, we don't really know, but if you go to each of the departments, I can tell you which departments got the money. Now, the Americans are much better than the Canadians in the sense that they tell you things. And so I phoned each of these departments, and I said, well, could you tell me what ME research they put this $40 million in? Dr. Hyde, they put 15 million into causes of alcoholism because alcoholics are fatigued. They put 15 million into cancer because, you know, cancer people are fatigued. That's where the money went. It didn't go to MECFS. And a couple of years later, this was broadcast through the networks in the United States, like this network, that the money didn't really go to research in MECFS. So it's a myth that a lot of this money actually went to where it should have been. And he started off, what was really interesting, the term everyone thinks first appeared in 1988. Dr. Strauss was using it in 86. And at these meetings, which I attended on the working case definition, and we left because none of them had ever seen an ME patient, but they were all, as far as I was concerned, friends of Stephen Strauss, and they got on the list of that definition. So I don't have anything good to say about this gentleman, except I met him in February of 1986 in Bethesda. I was trying to organize the symposium in Cambridge, England, which developed into this book. And I sat down beside him, and when another doctor came up and said, oh, we've just shown that Epstein-Barr virus has nothing to do with ME, which was his theory. And Stephen Strauss didn't open his mouth. He just sat there and glared at this doctor, who was the first person on the chronic fatigue syndrome bannerhead for the definition. Just glared at him, didn't say a word. And this doctor then moved away. He got a bit frightened. And then he started swearing. Those, and I'm quoting, those fucking assholes, those goddamn patients, they've ruined my life. And he went on like this, in that kind of language, for about 2 or 3 minutes. It seemed like an hour, but it was probably only 2 or 3 minutes. All the doctors around us got up and left. And when he calmed down and slowed down and stopped, I turned to him and I said, Dr. Strauss, I think you've had a seizure. Classical frontal lobe seizure. No, it's not funny. This is, when people do this, all of a sudden, out of the blue, this isn't because they're truck drivers. This is a serious frontal lobe lesion. And I said, have you had an MRI or CT scan of your brain? God damn you, there's nothing wrong with my brain. And I got up. I thought he was going to hit me, and I left. I'll go back. He had an astrocytoma, I believe, of the frontal area of the brain that he didn't realize until 2000, and he died in 2003. Had he got an MRI at that time, there's a possibility, because astrocytomas are pretty nasty things, that he could have got it out at an early stage. Classical MECFS type patient. Can't control themselves, can't receive information properly. He had a chronic fatigue syndrome that he didn't tell anybody about. He had a cause of this which could have been treated, possibly, if he'd been investigated and wasn't so damn certain that he knew all the answers. I wanted to tell you about this young lady. A short while ago, she was in a group manifesting in Tehran against the theocracy, the religious government, and one of the theocracy's snipers shot her dead. Does anybody know this one? Yeah. Shot her dead. And someone was a cell phone there and got her pictures, her dying moments. And she was carried away and secretly buried. This woman's name is almost the same, Neda Soltani. The only difference is there's an I at the end. But the government thought it was the same person and then tried to catch her. And she was a 32-year-old university lecturer. And she had in her passport an export visa to go to attend a conference in Athens. They were trying to put her into Avon prison where you get killed. She escaped. And this was her statements. She was placed in she got into Germany, she was put into a refugee camp, and she said, some of these people have been there for 10 years. You give up on your own destiny. You have to submit to whatever the system decrees. In my society, I had achieved so much, and now I had nothing. I was in a drawer, a folded labeled refugee. What if you just replace that with chronic fatigue syndrome? My daughter's actually in charge of refugee camp in Jordan. She's head of UNICEF. And she's got over 200,000 refugees there. And there's no hope for them at the moment. And I'm just pointing out how the difference, and I started writing another book at my wife's house called Medical Refugees, which I hope I'll finish sometime in the next year. But there's no difference between you people and these refugees in the camps, because except for, at least in a refugee camp, you've got a chance of getting out. There is a chance of you people getting out because some people do get better on their own. And some doctors do find what are some of the problems and fix them. I want to go into 6 slides now on the history of ME. It all started seriously in 1934 in Los Angeles County General Hospital, and that's a picture of that hospital, which is now closed. 198 physicians and hospital staff fell ill with incapacitating ME following immunization. I've examined 2 of those doctors. They were old men. They'd never recovered. I examined 1 nurse. I stayed with the doctor who was in charge of these patients at his home. He was retired. His picture's in our book. What happened was, in 1939, they received, each of them, $2 million each. The equivalent of $2 million. Whatever they received in Los Angeles in 1939 was equivalent to buying 2 houses in Beverly Hills. So a house in Beverly Hills is probably worth 2, 3, 4, 5, 6 million, I don't know. That's how much they received. This was a huge wake-up call, I believe, for the insurance company. Now, the important thing is they all fell ill during an epidemic, one of the biggest epidemics of ME that ever occurred. They thought it was polio, but almost nobody died. Some did die. But usually in a polio epidemic, you might get 10, 20% die. You get paralyzed people. These weren't paralyzed, but they had muscle weakness, they had all of the things of classical MECFS. But it followed both a viral infection, a known viral infection that was causing something like 100,000 people to fall ill between the Mexican border and San Francisco. It's well written up, except the National Institute of Health tried to prevent its publication, but he did get it published, this paper. But what is important is, number one, the immunization, the fact that immunization plus a viral infection, the two things coming together. And the other thing is this huge settlement. Ever since, the insurance industry has paid doctors to make fun of ME and CFS patients in court, and they are well trained, they've got huge statistics background, and it's been almost impossible, particularly in countries like the United Kingdom and England, to get any respect for these patients. They actually put ME patients in psychiatric hospitals in England against their will, and they fill them up with all sorts of drugs which make them worse, and they say, look, they're ill. What is absolutely important in examining any patient, I'm getting back to how I examine patients, what is absolutely important? You need a genetic history. And my first day visit is a day and a half with a patient. That's the start. That's before I do anything. And I spend that entire time taking down everything that happened to them from the day they were born to the present time. Their parents, their grandparents, their uncles, their cousins. And a quarter of the people who think they have ME or CFS have a genetic illness. They may have other things, but they got, in addition to everything, a genetic illness which comes because they chose their parents badly. The other thing is the historical illness, traumas. Traumas are really important in ME. A bad head injury when you are a kid, or at any time, but particularly when you're a kid, can so injure the central nervous system that the child doesn't know, parents don't know about it, but it breaks down what is believed by some to be a blood-brain barrier which prevents viruses normally from getting through if they don't come through in big dosages. So traumas are really, really important in this group of people. The other thing you need to know is before they fell ill, all of the immediate prior illnesses, because what you find out in a lot of these people is that in the year before they fell ill, they were still working, they were still going to school, they had one infection after the other. Every week, every second week, a new infection. They were dragging off to school, dragging off to work, but again and again and again. That only means one thing to me: a breakdown in the immune system. Something has happened to these individuals' immune system. And then the coup de grace, the final straw that breaks the camel's back comes. And this is the trigger. And this can be any combination of infection, immunization. And you don't have to copy all this down because I'm giving the slides and they can just print them out and give them to everyone. And so any combination of infection, immunization, medications, trauma, surgical procedures, transfusions, severe emotional injuries. My best friend was in his lawyer's office, and his longtime girlfriend was marrying an ambassador in Canada, and he begged her not to marry him. And she said, look, Charles, if you came back to me and married me, I'd drop my fiancée right away. But I want babies, and you don't. He said, no, let's come back and we'll talk about it. He said, no. And so she went through with marriage. She invited him. It was Saturday noon. Saturday noon, he was in his lawyer's office. I had done a complete cardiovascular workup on him a month or two before. Nothing wrong with him. Stress test, everything beautiful. He was vice president of a telephone company in the United States. He was in his lawyer's office. The precise moment his love married, He had a massive heart attack and died right there in the chair in front of his lawyer. Emotional stress can cause injury. I've got another friend who was working on West Nile virus because the Iraqis were sending rockets into Israel with West Nile virus, which I think then they also transported to the States. He took mice and he injected them with toxic West Nile virus that had been reduced in toxicity. He then put them under stress. He put them in cold water up to their ankles. He did all sorts of things. The thing that killed more mice was a half dosage of West Nile plus isolation. Put them away from their friends. And this is probably the biggest cause of suicide in ME patients, is they're away from their friends. They're away from their support. So emotional injury is real. But all these other things are real as well. But when you get this, you have to look at system injuries. You have to look at organ injuries. And only then, once you've done all of this, can you start to say what you've got.